Climate change is driving global temperatures higher. With warmer temperatures, pollen seasons are extending and intensifying. More patients are experiencing allergic symptoms than ever before. Leading allergists discussed at the American Academy of Allergy, Asthma, and Immunology 2025 annual meeting in San Diego how climate change is reshaping allergic disease.
Yeah, so some of the things that we've really seen is that there's an increase in the pollen seasons. So they've expanded much longer than they did previously. And it's affected different parts of the United States more than others. So like the West Coast and the Southwest, they've seen almost a 20-day increase in freeze-free days. So again, that lengthens the pollens.
At the meeting, an expert highlighted climate change's role in allergic rhinitis. Management approaches vary based on allergy type and patient complexities. Accurate pollen counts are critical for diagnosis and treatment.
So increased climate pressures and climate change can lead to breakdown of the skin or our epithelial barrier, and the pressure that puts on particularly pollinating plants to increase their pollen levels then increases the amount of pollen that is absorbed through the skin, and that can actually lead to increase in allergies. One of the effects of that is something we call pollen food syndrome. So not only can we see an increase in pollen allergies with climate change, but we can also see an increase in food allergies that are related to cross-reactivity with pollen.
Especially also with air pollution, we have seen that really impact the allergenicity of the pollens itself, so making them more allergenic than before when they're combined with things like diesel particles.
Climate change exacerbates chronic allergic reactions. One example is chronic rhinosinusitis.
So climate change, I think what we're seeing is that patients with allergies are being affected by climate change, and then that also extends to patients with chronic rhinosinusitis. The origins, the impetus for chronic rhinosinusitis really involves external environmental triggers that disrupt the epithelial layer of the nose and the paranasal sinuses that results in the subsequent inflammation that characterizes chronic sinusitis. So if we have higher allergen exposures, environmental triggers that cause injury to the epithelium of the nose and the sinuses, then we would expect to see higher incidences of chronic rhinosinusitis.
Experts warn of worsening allergy trends in a changing climate.
Some of the concerns between climate change and allergic disease, more globally, we think about pollution, for example, being linked to increased rates of asthma, airborne particulate matter also being linked to increased respiratory conditions, in addition to the things that we've talked about where we have increasing rates of pollen food allergy syndrome, increasing eczema, which seems to predispose particularly young children to allergic disease, and then the tick-borne alpha-gal syndrome also on the rise.
So the main change that we're concerned about is the pollen count, meaning that the amount and the duration that these trees pollinate. And the climate change and other factors related to it do not only increase the count on tree pollens, it also impacts grasses and weeds, especially ragweed. So that's the one that concerns us the most, because that means that our patients who are allergic are exposed longer or more intensely, and also the chance of people becoming allergic to these is higher. And that's what is the definition of allergic rhinitis.
Now more than ever, it is important for allergists to consider climate change when diagnosing patients.
So the intersection of environmental changes and allergies really seems to be something that is increasing in awareness and diagnosis. So we have to maintain an openness to finding more and more patients that are suffering from both eczema, food allergies, and even the mammalian meat allergy, alpha-gal syndrome. What we've asked for our healthcare providers is to just be on the lookout for perhaps diagnoses that maybe you haven't seen in the past. You may have been in a community where, for example, there weren't Lone Star ticks, and now there are. So in the past, you may not have seen patients that have alpha-gal syndrome, but you may now increasingly see those folks. So we want people to be aware of the changing landscape, the impact of environmental and climate pressures, and this rise in allergic diseases.
Explore the latest allergy research at hcplive.com and subscribe to stay up to date on the latest healthcare news.